Okay, everyone. Now we're going to be talking about health psychology. Some of the topics we're going to get to, defining what health psychology is and some of the related fields. Talk about how to make effective changes to make your live a healthier life. Talk about how psychology really can play a big role in understanding how we live well, how we can make positive life changes, how we can do things that will help us have a healthier body. Okay, let's talk about the field of health psychology here. Basically, health psychology's role is to help people in terms of establishing health, preventing illness. However, in this case, with psychology, it focuses on social, behavioral, and cognitive factors. So your thoughts, your feelings, your interactions with others, all of those are relevant when it comes to staying healthy. So health psychology focuses on those factors in terms of understanding health. If you want to learn more about health psychology, you can click on this link here. This is Division 38 of the American Psychological Association, Health Psychology, and this website kind of gives some information about what health psychology is about, some of the journals that they publish, and kind of a good resource for you if you were interested in looking at health psychology. Behavioral medicine is a related field. It really focuses more on the biomedical knowledge. So looking at social factors, looking at behavioral factors, but biomedical is where it's coming from. While health psychology is centered around psychology, behavioral medicine is in the field of medicine. But nevertheless, it is looking at how our social relationships and how our behaviors can impact our physical health. Health promotion is essentially an applied field that looks at trying to find ways to help motivate people to stay healthy, and do essentially as an advocate for good health, trying to send that message. So it's promoting healthy lifestyles, doing things that help people doing things that help people improve their health. Finally, public health takes a big picture view, and they're looking at the health concerns of a population, of a society. So if we're not just talking about the health of an individual, consider this. Health psychology may be looking at how individuals can do things to improve their health, and how their interactions with others, their behaviors, their emotions, their feelings impact their health. But we're kind of still talking about an individual's health. Public health, we're talking about the health of a community, health of a population. And there are factors that can affect everybody that have an impact on public health. Pollution, environmental disasters have an impact on public health. In fact, there's a controversial point of view that our policy on guns in this country also has an impact on public health, and there's a lot of evidence to support that point of view. A lot of people coming into the hospital from gunshot wounds. A lot of people commit or attempt suicide using guns. So basically, emergency rooms across the country need to be well trained in how to deal with gunshot wounds. That's a public health problem. And there may be a controversial viewpoint for a society that wants to have complete freedom for gun owners, but nevertheless, it can't be ignored as a public health problem. The biopsychosocial model really is a good model for understanding physical health, as well as many other aspects of behavior and mental processes. So health psychology really uses this model a lot, understanding that there are these three factors. There are biological factors, psychological factors, and social and cultural factors that can have an impact on somebody's health. It's how we think in terms of our psychology. It's how we are built biologically, and it is how we interact with others. All of these are important in understanding health. Here's an example of how the biopsychosocial model can be applied, in this case, to smoking behavior. And we know that smoking has a negative impact on our health, and we essentially saying, well, why do people smoke? Even though we know it's unhealthy, why do people still do it? Well, there are biological influences. There are certain people who might be more prone to addiction when it comes to nicotine. And once you have started smoking, once you have developed an addiction, it's a physiological condition that you can't just turn off like a switch. So the process of quitting smoking, who is physiologically addicted, is a very, very tall order, and it's very hard to do. There are also psychological influences. As an adolescent, for example, which is when people most often start smoking, adolescents are kind of in that transition period between childhood and adulthood, and they kind of want to be an adult, and they want to be cool. They want to, they're really focused on their image. And smoking presents an image that they may feel is appealing. And they don't necessarily think too much about the consequences later on. And adolescents are very good at thinking about what feels good now, but not so much thinking about the consequences that come later. Finally, there are social and cultural influences. If you have friends or family members who smoke, it makes you much more likely to smoke. If you realize that tobacco companies do a lot of advertising to try to get people to smoke, although now there is a lot less advertising for smoking now. It's almost been eliminated in the United States, and that's because of the law. Laws have been passed that have banned smoking ads on television. They've banned smoking ads on radio, smoking ads in magazines. So there has been, and basically, as a consequence of those policy changes, there has been a drastic reduction in smoking in the United States. Meanwhile, in many other countries, tobacco companies, advertise a whole lot, and their smoking has become much more popular abroad than it is in the United States. Advertising plays a big role in this. Well, some of us, well, not just some of us, all of us, have some habits that we probably would like to eliminate or reduce. We have some good behaviors that we would like to do more. We'd like to exercise more, perhaps. We would like to eat healthier foods. We'd like to quit smoking if we smoke, cut down our drinking, all sorts of things that we'd like to do to improve ourselves. We'd like to study harder and longer, perhaps to do better in college. Many different examples of things that we would like to do. And there are a number of theories in psychology that talk about what factors are involved in our decisions to change our lives, to make changes in our lives. So the theory of reason action talks about, and the originator of this theory is Isaac Asimov, and he talks about if you want to effectively change, you want to change. You have specific intentions about it. That's where where the key here is the intention to make change. So we're talking about making a conscious decision to change your behavior, and that comes first. You want to be able to have a positive attitude about this behavior, otherwise you're not going to do it. And you want to have a belief that there is social group support in engaging in this change. Ajahn has updated his theory to call it the theory of planned behavior. He's added some more variables to it. So in this case, the perception of control over the outcome is the key. The belief that you have control over the outcome. If you want to learn more about the theory of planned behavior, you can click on this link over here, and it will bring you to the to Isaac Hodgkin's website regarding, and it'll show you the model of the theory of planned behavior. So this website gives you the various components of the model, the theory of planned behavior model, and you can click on each one to get more information about it.